justifying the ART bill, the new bill of 2021. Our Honorable Health Minister Mansukh Mandia ji said that the new ART bill and the surrogacy bill is trying to provide a better ecosystem both for the gynecologists who are experts into it and to the patients with better medical care and security, including the new technologies in assisted reproductive technology. And this will benefit patients, leading to an increase in awareness for cause and treatment of infertility. This new bill was welcomed by Foxy. You can see the stalwarts here. As far as the flow of this particular presentation is concerned, I'm going to tell you about the overview of the ART bill, the authorities which are going to regulate ART, the registration of ART clinics, the duties of ART clinic and ART banks, regulations for donor banks, rights of a child born through ART, offenses and penalties, and a clinical applicability of ART bill. Coming to the overview of the ART bill, we all know that increase in infertility management approaches paved the way for legislative support. We all know that 85% of infertility cases do require medical and surgical treatment, and are new technologies which are coming up and added every day. In the last 20 years, we have seen exponential growth of the infertility clinics. The framework of regulatory guidelines was done as way back in 2008, where various experts had joined hands, and this was put on the website of the ICMR in 2010. It has taken good long 12 years for it to see clearance from the Parliament. Now, what are the three purposes of ART Act 2021? The first is regulation and supervision of ART clinics and banks, prevention of the misuse, safe and ethical practice of ART services. This new bill has 6 chapters and 46 clauses. The first chapter is preliminary. The second one is authorities to regulate assisted reproductive technology, first at the national level, then at the state level. The procedure for registration. Duties of ART clinic and ART bank in the 4th chapter. And the 5th chapter takes care of the offenses and penalties, and the 6th chapter is miscellaneous. It has 46 clauses. Now coming to authorities that regulate the ART bill. My request is please switch off your things at your end. What are the authorities that regulate ART? At the national level, there is an ART board and the surrogacy board. At state level, again, there is an ART and surrogacy board, national ART and surrogacy registry, and appropriate ART and surrogacy authorities are created already. Now, as far as this national ART technology board and the surrogacy boards are concerned, the power and function of this board are to advise the central government on policy matters related to ART. Second, to review and monitor the implementation of ART bill and recommend changes. To lay down the code of conduct for clinics and the banks. To ensure effective performance of relevant bodies. To supervise the functioning of national registry and license with the state boards. To set the standards of infrastructure, equipment and manpower, and to pass orders as per provision made under the ART bill. As for the state ART technology and the surrogacy boards are concerned, there is a definite composition of the board, terms of office are clearly defined, how frequently they should meet, how the vacancies to be filled, and the eligibility of the members for a reappointment is also, guidelines are there. The provisions applications to the state assisted reproductive technology and Surrogacy Board. Now, what are the responsibilities? The responsibilities is to follow the policies and the plans laid by the National ART and Surrogacy Board, to enforce and implement these plans. Now, this national registry has got three facets: the scientific one, the technical one, and the administrative support. The functions are to collect the central database and providing data to the National ART Board. National ART and Surrogacy Registry and the appropriate ART and Surrogacy authorities, we find that the authorities appointed for each state and the union territories has been done. It will have officers, medical practitioner, female representative of various women NGOs. The functions are mainly four: supervision of implementation of ART bill provisions, enforcing standards and handling registrations, maintaining details of registration, certification, and licensing related matters, investigation of complaints of breach of the bill and taking relevant action. Now, as for the registration of ART clinics and banks are concerned, only clinics which are registered, only banks which are registered will function, and the rest have to close. Application to be made to the National Registry, which we already have done it. Approval of the appropriate authority is necessary for every clinic and bank. Appropriate authority can suspend or cancel registration, just like PCP-NDT. Duties of ART clinics and ART banks. The foremost duty is ensuring eligibility to avail ART procedures, obtaining donor gametes, and ensuring that the donor is medically tested. We need to ensure the confidentiality of the involved parties and providing support and professional counseling to the commissioning couple. The other duties are maintaining a grievance cell for complaints, applying ART services, issuing discharge certificates of the ART procedures which had been done in your center, and providing information to the National Registry related to enrollment, procedures, and the outcome of every case. The clinics and the banks are not allowed to perform procedure without consent and the insurance coverages. It is mandatory. Engage in cryopreservation without the consent and instructions. Use human reproductive material to create a human embryo. It will not be done, it will be done according to the ART bill. Use and vitro human embryo for any purpose without specific consent. And the consent can be withdrawn by the clients at any time before the transfer of embryos or gametes to the uterus. All clinics and banks must maintain detailed records of all donor oocytes, sperms, and the embryos. The check can be made from time to time. Submit progress reports to the National Registry. Submit information pertaining to the number of donors to the National Registry. Keeping accurate records is mandatory. The records must be maintained for at least a period of 10 years, except under special circumstances, after which it is transferred to the central database of the National Registry. As for the regulation on handling the human gametes and embryos are concerned, not more than 3 oocytes or embryos may be placed in the uterus of a woman. not more than 3 embryos. Gamete or embryos derived from only one man or a woman. No mixing of semen of 2 individuals is allowed. All of us have discussed in detail about these things, and we are very clear about these. Now, we can already see the implications of capping on the number of eggs that can be retrieved. We are advised to use a softer protocol and not overstimulate the ovaries of patients, as to retrieve around 10 eggs, and by the time they are fertilized, not more than 7 eggs are there. So we like to have comments of the experts on this particular aspect. Now, coming on to the regulation on handling human gametes and embryos, the embryo splitting is prohibited, which we were doing till now. Consent for posthumous gametes collection has to be done before, then only it will be allowed. The use of ovum derived from the fetus or for IVF is prohibited. Now, as for the donation of embryos for research can be done only when the embryos are pre-existing, when the embryos have pre-existing heritable, life-threatening or genetic disease, with the approval of commissioning couple of the woman. Without the consent of the patient and the couple, nothing can be done. This is for pre-implantation genetic diagnosis is concerned. In pre-implantation genetic diagnosis, it will be only done when the embryos are pre-existing, have a heritable, life-threatening or genetic disease, and it will be with the approval of the consent of the couple. Sex selection. Clinics are not allowed to offer a couple or a woman a child of predetermined sex. Determining the sex of the child to be born through ART, we are very clear, no sex selection. Separate or yields fraction enriched the sperm of X and Y variation. Fortunately, we do not have that kind of technology available, but whatever it is prohibited. Help is the probability of an embryo of a particular sex. Also, no guidance can be given that you have a relationship during this particular time, and have a child, look at the Chinese calendar to have a sex of their own choice. Any of these things are not allowed. Now, coming to the regulation for the donor banks. All banks must be registered. Now we all know that the cost of the 5 years has been curtailed as far as the banks are concerned. Now it is 50,000, just like IUI. The males who can donate should be more than 21 years and less than 55 years. Females who will like to donate the eggs will be between 23 to 35 years. Sperm or oocyte of a single donor will be used for only single couple. Oocyte donor can donate only once in a lifetime. Even semen donor can also donate once in a lifetime. And that is why we find already the cost of the semen samples have increased tremendously. Now, as for the storage, sale and handling of human gametes and embryos are concerned, the maximum storage period is 10 years. Central government defines the standards. Sale, transfer or use of gametes, zygotes and embryos without permission is prohibited. Due to prohibition on the sale of embryos, have you seen a decline in the number of donors? In fact, as far as I'm concerned, I can see that the donor community has disappeared from Delhi. What is there in the rest of the places, I do not know. Coming to the rights of the child born through the ART. Rights of the child born through ART, they are entitled to the corresponding rights and the privileges only from the commissioning couple. Donor must relinquish all parental rights. Coming to the offenses and penalties, engaging in activities pertaining to felicities of sex-selective ART is prohibited and punishable. Abandoning and disowning or exploiting the child born through ART. Exploiting the commissioned couple or a woman or the gamete donor. Transferring human embryos into male person or an animal. Using any intermediates to obtain gamete donors or purchase gamete donors. Middlemans are not allowed. Individuals found guilty of being involved in such activities, which I have just described, will be subjected to fine up to 25 lakh rupees and imprisonment up to 10 years. Now the question is again to the experts and the people who are viewing me. In your opinion, will there be any challenges in the following these clauses laid down by the ART bill as for the offenses are concerned? I think the law of the land must be respected in the total spirit. Clinical applicability of the ART bill. It provides a platform for clinicians to suggest their inputs to improve the ART. So it is a long drawn process. The inputs will be taken, and from time to time, the national and the state boards will make necessary changes in future. There'll be a better understanding of clinicians' role in ART and better understanding of patients' responsibilities as well. Coming to the clinical applicability, it will help to reduce malpractice and fosters a stable environment for ART in this country. Helps to avoid confusion and streamlines the treatment process. Clarity is given both for experts as well as for patients. Another question which comes up: have there been noticeable improvement in ART since introduction of the ART bill? If I have to make a comment, yes. People who have been ART experts have crystallized in their mind, are they going to do surrogacy? Because there's a separate charges and separate board for things. People have to be very clear whether they're going to keep on practicing donor IVF. And in case if it is so, they have to follow the guidelines in total. Has there been any significant change in your practice of the introduction of ART bill? A lot of clarity has come to us. Do you think the special provisions should be made in future, or which will be added in the ART bill for members of LGBTQ community, lesbian, gay, bisexual, transgender, queer community? What are the implications of regulations listed in the ART bill for use of gametes for research? Again, I will request the experts to throw light on this. Do you think this ART bill will impact the adoption or orphan children in the country? If so, how? With these remarks, thank you very much for listening the salient features of part 1 of this presentation. Thank you very much.